Good morning, students. Today we're going to learn about the picture labeling, the first video for the P2. Let me get the pen. Here we go. The first picture here in front of us, that is the very important joint. Okay. Except this, we are also having glenohumeral joint and acromioclavicular joint, but this is a sternoclavicular joint that is important also. We got here the things to label. Here we go, the first rib, and this is the cartilage of the first rib. This is a manubrium of the sternum. This is the body of sternum, and this is the place where the second rib will articulate. And this is the angle of the sternum. This joint, when we talk about here, that we got here the clavicular notch, okay, and here this part we are having the articular disc and its capsule, and we are having the very important ligaments here, anterior sternoclavicular ligament, and the same place at the back side we are having the posterior sternoclavicular ligament. We are having here the interclavicular ligament and the ligament that is attaching also with the first rib and its cartilage, that we call that costoclavicular ligament. So pay attention that anything could come in the examination. Next, we are having this picture. In this picture, we are having a lot of muscles to talk about. So first of all, we can see here inside that is the glenoid cavity, and around it that we are having glenoid labrum, and then superior to this we are having the long head of the bicep tendon over there, and inferiorly this part here we are having the long head of the tricep brachii muscle. Let's talk about here anteriorly that we are having the pectoralis major muscle, and this one is the short head of bicep brachii, and posterior to this it should be the coracobrachialis muscle. Anteriorly we can see here this part, which one is making the cuff around it, that is the subscapular muscle, and superiorly we got here the deltoid muscle, and here we can see the tendon of the supraspinatus, and here we are having the infraspinatus, and here we are having the teres minor. So subscapularis, supraspinatus, infraspinatus, teres minor are making the rotator cuff around it. We got here the downside that we can see the teres major muscle here, and we are having anteriorly this part that is a latissimus dorsi muscle, except that in this picture we can see the bursa, subscapular bursa here, and superiorly we are having the subacromial, also known as subdeltoid bursa. Okay, and this picture you must pay attention on it. Next, we are having here the posterior scapular region. In the posterior scapular region we are having these muscles here, supraspinatus, infraspinatus. We got here the teres minor muscle, teres major muscle, long head of the tricep muscle, and also some the medial and the lateral head of the tricep is also over there. We can see here that the first of all the suprascapular artery over there, and with it we can also see that the nerve. We got here the ligament at this place, okay, which is covering the suprascapular notch. We call that superior transverse scapular ligament. After that we are having here the axillary nerve. Okay, axillary nerve is having its two part, that which one is going to the deltoid, and the lower side this one is going to the little part of the deltoid skin, on the little part of the deltoid, and this gap here, that this is the quadrangular space at the posterior part. That we got here the circumflex scapular artery at this place. We got here the radial nerve and the profunda brachial artery. So in every picture, at least the important thing, the 10 you needed to pay attention and remember. Let's go to the next picture here. In this picture that we can see that is showing the axillary artery and its branches, except that other structures you should also mention. So the axillary artery, from the first part, that here we are having the first branch, which one is what you call that the superior thoracic artery, and from the second part which is covered by the pectoralis minor muscle. So in this part that we are having here the lateral thoracic artery, and also we got here thoracoacromial artery respectively, these two. And then we are coming downward and around this part, that the third portion here, we are having the superior, or sorry, the subscapular artery, and we are having the anterior and the posterior circumflex humeral artery, except that the profunda, brachial, and the bony structure could also be asked in this kind of portion. So up to here. Next we go to here, the next picture, in which we are having the cubital fossa and its content. Here we can also ask about the muscles, and but mainly the structures we need to remember here. We got here very important artery passing through there, that is a brachial artery. Now you can see that is branches over here, the radial and the ulnar respectively. We got here the ulnar nerve, we got here the median nerve, and this side we are having the radial nerve. After that we are having here the portion, that the muscle, that is this part here, the superficially, that we are having the bicep brachii muscle, and posterior to this you can see a small nerve, that is the musculocutaneous nerve, and posterior to that there we can see also the radial nerve, and inside that is the humeral bone. The backside, that muscle we are having, that is the tricep brachii. So right under the bicep here you can see another muscle, in this part, this is the brachialis muscle. Downside here we are having the pronator teres muscle and the brachioradialis muscle. Need to see that very clearly, they are making the boundary. And after that we are having the flexor muscles of the forearm, can also be asked in the examination, so remember about this part also. So thank you very much up to here. See you in the next video.